You have said that if this transition doesn't get going, especially coordination on vaccine distribution, that lives will be lost.
There is no excuse not to share the data and let us begin to plan. Because on day one, it's going to take us time. If we don't have access to all this data, it's going to put us behind the 8 ball by a matter of a month or more. And that's lives. How many would be lost as a consequence of that? I can't tell you.
President-elect Biden earlier this week. Let's talk now to the Operation Warp Speed Chief Science Advisor, Dr. Moncef Slaoui. Dr. Slaoui, thank you for joining us this morning. You heard the President-elect right there. You heard Ron. Thank you. You heard Ron Klain as well saying the failure to communicate with the transition won't affect vaccine distribution now, but it could affect it once Joe Biden is president of the United States. How much are you concerned about the lack of communication with the Biden transition team?
Well, we are focused, frankly, on making sure that the vaccines are made available as quickly as possible and distributed as efficiently as possible, regardless of the political context that surrounds us. Of course, we would hope that transition happen quietly and smoothly, and we're here to serve the American people and the American population, and we'll do our best. So we are concerned with anything that could derail the process. As it stands now, I can't see that happening, but hopefully it doesn't happen.
Have you had any contact with members of the Biden transition?
No, no contact.
But wouldn't that help ensure a seamless transition from one administration to another?
Frankly, as I said, we're here to serve. If people want to contact us, of course, we'll be available. I understand, as you know, I'm not a federal employee, but I understand the rules are such that confidential information needs to be kept with the federal employees. I'll make sure I look at that. But otherwise, of course, I'll be happy to be contacted and explain what we're doing, as I'm doing it now to all the public.
Walk us through what we can expect going forward with both the Pfizer and the Moderna vaccines.
Yes, so the two companies are working 24/7 preparing their files. As you know, Pfizer already filed yesterday. Moderna is planning to file by the end of this month. The FDA will review the files, and in parallel to that process, the CDC and its Advisory Committee for Immunization Practices will also review the data, so that when the FDA on December 10th for Pfizer and on December 17th for Moderna reviews and gets the advice from its Advisory Committee of independent experts and hopefully approves the vaccine, the CDC will almost immediately ask the ACIP for what recommendation and what guidance they would give to the population in terms of immunization priorities. We are ready to start shipping vaccines within 24 hours from approval, ship them to the sites that each state that are allocated a quantity of vaccine that's proportionate to their population tells us where to deliver the vaccine. We'll have the vaccines there the next day after approval, and hopefully people will start to be immunized, I would say, within 48 hours from the approval.
Presumably healthcare workers are at the front of the line, but we're even seeing some hesitancy among healthcare workers, doctors and nurses, about taking the vaccine. If healthcare workers on the front lines are hesitant, what does that mean for the broader population, where we know there has been some skepticism about taking the vaccine?
Well, I'm very, very concerned about the hesitancy as it exists, and I think it's very unfortunate because this has been exacerbated by the political context under which we have worked very hard with the companies and with the thousands of people that have been involved to make these vaccines available. The vaccines have been developed as thoroughly and as scientifically as ever. I've been doing this for more than 30 years. This vaccine development is not different than any other, except that we have gone at an incredible fast speed with incredible resources and incredible commitment by all the parties. We know that these vaccines are highly effective. They are as safe in the short term as any other vaccine that's already approved. we will be looking for the long term at their safety through very active pharmacovigilance. The CDC and the FDA are working together in setting that up to a level that's almost close to a clinical trial. And I feel very comfortable that these vaccines are safe. I'll be happy to take the vaccine. I'll be happy to have my children have, or my parents have the vaccine. And we will be totally transparent with every single bit of data and information that we know about the vaccine for everybody to listen. The key, frankly, is please don't make up your mind before you listen to all the information that the FDA and that the CDC and that all independent experts in the country will be able to look into and advise you.
As you know, the
Please
president has
listen and then make up your mind.
Thank you, sir. As you know, the president has complained that Pfizer delayed the reporting of the clinical trial success until after the election. Do you have any evidence of that?
Well, listen, our partnership with Pfizer is slightly different than, for instance, our partnership with Moderna, where with Moderna, we have been working every day on every single aspect of the vaccine together. With Pfizer, it was more an arm's length relationship where we have supported them in terms of creating a secure marketplace for them. We pre-purchased vaccine as a commitment. We also helped them on manufacturing, raw materials, and things like that. But we haven't been with them on a daily basis, so I don't know the specifics. However, I do think that asking for 60 days follow-up after completion of immunization to ensure that we understand the short-term and the predictable long-term safety of the vaccine is an appropriate decision. And I understand that that's what drove the timelines of Pfizer. So as far as I know, I don't think any specific action has taken place to delay the vaccine.
Dr. Slaoui, thank you very much for your time this morning. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.